That's all right. This is an issue that affects 1 in 41 South African women. We are taking your calls this morning, 0839133728. If you can identify with anything that we're talking about, Dr. Darren is here for you. Now, Dr. Darren, I'd like to move on to cervical cancer now.
Sure.
If you know that you have HPV, what happens next? What's your next step?
Yeah, so what we generally do, ladies have the dreaded pap smear.
Yes.
And what was so nice about the segment we just saw is having a home test for HPV. You then have a definition of a lesion as it's described according to that smear, where we get a degree as to how rapidly those cells at that transition zone between the outside part of the cervix and the inside part, the ecto and the endo, that transition zone, and how quickly the cells are developing, whether they're normal or abnormal. It gives us an idea.
Okay.
So what we actually need to do...
Signs and symptoms?
That's correct. So if that becomes inflamed, you can imagine, then you have things like bleeding, abnormal discharge, and at the later stages, things like deep-seated perineal pain, and then loss of weight, etc.
Okay. Now, I was also just wanting to ask you, how often should we get screened for HPV from your point of view and cervical cancer as well?
We suggest that you have an annual pap smear, and you know, I think it's important, depending on your age as well. Postmenopausal women can be harder to detect cervical cancer because that transition zone is not easy to visualize with direct colposcopy by the gynae. So they often need a more extensive form of testing with a biopsy taken, a conus biopsy or a LETS, a laser biopsy.
Now, we had a caller who doesn't want to go live, but she wants to know, do you still need to have a test after you've had a hysterectomy?
Yes, so if you've had a hysterectomy, a radical hysterectomy, it implies that basically the uterus is removed with the cervix, and you'll just have a vaginal vault left. Okay. So no, you wouldn't. The reason for the hysterectomy was specifically cervical cancer, late stage. Those transition zones would have been removed or cut away completely, and late stage, even radio and chemotherapy added to the therapy.
I know that there are many people who might want to know this. What are the treatments out there for cervical cancer, and what's the prospects thereafter? What's the outlook?
Yes, so early detection, early stage is surgery, you know, so they actually cut out the cancer, simple as that. Late stages, you go on to just radiotherapy and chemotherapy. Okay. And that's as simple as that. And
prospects thereafter?
Yeah, well, the prospects are good because of the interventions we have in detecting it. As I said earlier, we only detect it late because of the symptoms and signs that occur quite late in the disease. So with the emergence of these wonderful tests that we can use at home, and also the awareness amongst our young girls and the use of the vaccine, the prospects look very positive.
Absolutely. Well, we will continue talking about this on your Feel Good Breakfast Show, 0839133728. We've got Zanele on the line. Zanele, good morning. Welcome to Expresso.
Good morning.
Good morning.
My question is that I had cervical cancer from last year, but I couldn't do it hysterectomy because it was so late. And I've done radiation and I finished it. But the problem, my stomach is swollen and very sore.
Sure.
So she's had radiotherapy for a late-stage cervix cancer, and she's mentioning some secondary side effects post-radiation therapy, and there are quite a few because those radio waves can affect blood vessels, they can affect the other surrounding tissue. When you have radiotherapy, try and shield the surrounding tissue from those radio waves, but often it can affect things like your bowel and your digestive system.
Will things return to normal?
Yes, well, she can. I think she needs to see a general surgeon for that, and certainly let her oncologist know that she's experiencing prolonged abdominal symptoms and pain.
Okay, well, there you go, Zanele. Definitely go and chat to your surgeon about that. But, you know, one thing about cancer is it's important that we know these things. It's important that we inform ourselves, but it's important that we also know that there is people out there that have survived, and you is speaking to one of them.
Indeed.